Hello, this is A Livelihood, New Careers as We Age, and I'm your host, Kitaj from LightSpring Coaching. And today we have Caro, who's going to be with us and who's going to talk about a project that she's been involved with for the last few years. And welcome, Caro.
Well, thank you. Thank you for having
me. I appreciate your wanting to be on the show. I want to hear from you about how you got involved in the Sister City Project.
Sure. Well, first of all, it's my profession is I'm a librarian. And we had lived here in Brookline, maybe 10, 15 years at that point, and there was an announcement in the tab that the Brookline Sister City Project was taking on the project of building a library, and that attracted my attention. And I thought, this is something I want to get involved with. And Nicaragua, being a Spanish-speaking country, also interested me because I speak Spanish, and I have lived in South America, so it was of interest. And I contacted the Sister City people and asked if I could get involved with the project, and that was maybe 6 or 7 years ago. I can't exactly remember when, but I've been involved with it since then. Well, it's more than 6 years ago because the library just celebrated its 6th anniversary in Quezalguaque, so it was before that.
Yeah, and my understanding is that the Sister City Project, though, has been going on for many years.
It's been going on for 21 years. Well, the project was designated by the town meeting in '87 to be Brookline Sister City, but 2 years prior to that, Maxine Shaw, who was one of the original founders, was living and teaching in Nicaragua, and people from Brookline, her friends, happened to go visit her, and they all got involved down there, and that's how it came to be the Sister City for Brookline.
Right, and during that period, you've gone down for various projects.
Yes, I've been to, it's terrible, I can't even remember whether it's 5 or 6 times I've been down to Nicaragua, and we've been down for any number of projects. The first one that I went down, I think that I was involved with, was we did a project with Habitat for Humanity in building homes. And another time we went down and we were repainting the library. And other times we were down, the latest, the second to the last time we were down was very meaningful for me, at least. It was a planning meeting that the people in the town and the people from the 15 rural areas surrounding the town came together to decide what project they wanted to work on with Brookline in the future. So that was really wonderful to see all these people get together and spend, half a day discussing and then finally voting and determining which project they would do. And the part I found really wonderful was that even though all these little areas had projects they wanted, they all coalesced around this one rural area that had no school. That's the project that one of the projects we're concentrating on right now is the building this school in Soledad Nueva, which is the name of the little community.
So that's your next big undertaking.
That's what we're doing. It's moving along very rapidly. Most of our work for that is really being done here, fundraising for it. And we're currently working with any number. We're working with 3 or 4 of the public schools and working with St. Mary's School, that the students are involved in helping fundraise for it. And the theme is one block at a time. The school is built of, as most things there are built of cinder blocks. And so the school children are raising funds one block at a time.
So, what I'd be interested in your describing is, what are the people like that you work with in Quezalguaque?
Well, the people are. It is a town of. The whole town in the rural area is about 9,000 people. There's close to 2,000 live in the urban center. The rest of them are scattered around in rural areas. Most of them are agricultural workers. In town, there are people who, maybe have a little store, or somebody who there's a saddle maker in town, and there's somebody who has a mill who grinds the flour and also grinds cheese for their cheese making. And there's other little stores around in town. There's a hardware store, and so they're modest income level. In the rural areas is where most of the poverty is, although there are some extremely poor families in town too, but it's mainly in the rural areas, and a lot of those people are sugarcane workers. But unemployment is very high. Nicaragua is a country of not dramatic natural resources. There's a lot of coffee, but it's not on the coastal areas, it's in the mountainous areas, so there's not coffee workers. And there's some fishing on the ocean side, but that's a little too far away for people in Quezalguaque to do that as a living. And there's some mining that goes on, but not in the area where they are. Now we've been involved with 3 health centers. The one in the top is the Central Health Center in town, which the sister cities in Brookline helped to build. There have been some other people who've helped do different additions. Right now, we're currently trying to raise funds to expand the emergency room. The emergency room is the size of maybe 3 closets in someone's house. It's very small. These other 2 health centers on the bottom are outlying health posts. They're smaller, and the one in the bottom right-hand corner is very remote, and the health committee of Sister City here is now sends money to pay so that the doctors and nursing staff have a way of getting out to this health clinic, because it's so remote they have to go by a cab to get there.
So, Caro, maybe this is a moment when we can talk a little bit about the health project that's going on, the research, because I think that's very important for the community.
Well, a couple of years ago, a group of students, 4 public health students from BU, went to Nicaragua to do a general health survey. And they went down and spent, I think, about 6 weeks, or maybe it was 4 to 6 weeks there in the summer, and they did a general health survey. And one of the things that they noticed, and other people had been noticing, is that there seemed to be an excessive number of people with kidney disease. And so the following up on that, last summer, a group of 6 students from public health department at Harvard and at BU, and 1 medical student from BU went down and worked for 6 weeks doing testing of people. I think they tested more than 700 and something people. They had gone down previously. Some other group had gone down and looked through the medical records to see areas where people had kidney disease, and so they went to those areas and they tested everybody. And the tests were quite dramatic, and that there's a very high proportion of people who have the disease.
I've read that it's like 10 times the normal.
Oh, absolutely. And in some age ranges, it's much more. It's maybe 50 times the normal that in other countries.
Thank you so much for coming. So join us again next week.